Hej och välkomna till Coegin News. För ett tag sedan frågade vi i våra sociala medier vilket portföljbolag ni ville veta mer om. Många är intresserade av Avexxin Oncology, så vi har bjudit in John Zibert igen. Han kommer att berätta lite om det första Scientific Advisory Board som man har haft i Avexxin. Welcome, John.
Hi, Me. Thank you so much for giving me the time to actually talk a little bit about our recent efforts in Avexxin Oncology. So last Friday, we were having the first scientific advisory board of Avexxin Oncology, and we had the pleasure of actually inviting international experts from Scandinavia, among others, Professor Thomas Dittman, professor in bioinformatics, and also with a specialty within multi-drug resistance in cancer. Then from Sweden, we had Professor Thomas Fioratus, and he's a professor in clinical genetics from the University of Lund in Sweden. And then from Norway, we had two professors, Bjørn Thor Gjertsen from the University of Bergen, and he's a professor in clinical science and hematology. And then finally, Professor Magne Børtsist, professor in clinical and molecular medicine at St. Olavs University Hospital and NTNU in Trondheim. So it was a very good meeting. We had some super good feedback, some good discussions, and also with our own brilliant researchers, among others, Professor Berit Johansen from Avexxin Oncology and Coegin Pharma, and then also Dr. Felicity Ashcroft, and she's also working very closely with the Avexxin and Avexxin compounds.
That is a lot of experience and expertise in one place. Did you come to any new conclusions?
Yeah, we came to some super good conclusions, and one of the key elements is that we will focus still on leukemia. We got a long way already, and we will continue to showcase if we can, show proof of concept in leukemia. And in particular, we're looking at acute myeloid leukemia, also called AML. We will also try to look at solid tumors, such as the ones of the breast, ovarian, or colon. We'll spend some time in actually figuring out which indication is it that we really believe that we should move forward into. We have some very good data in triple-negative breast cancer, and we will, try to see if that is the indication we want to pursue in a clinical setting. But before we go into a clinical setting, we, of course, need to look at the specific biomarkers for AVX420. So that is also a key focus area for us. So we actually can predict who will actually respond to AVX420 and how do we actually see early engagement of the compound in the human beings. And then finally, we will also work on testing AVX420 in our novel formulation for intravenous injection, so into the blood. And for this, we will test this or make a plan for testing this in different mice models. And in these models, we can actually validate the biomarker work that we've been conducted, but also try to look at the efficacy in the mice.
So what is happening next?
Yeah, the future roadmap is now very defined. We have a way forward towards what we call preclinical testing. So testing in mice if AVX420 is safe and tolerable, but also in two other species. And this will allow us to move into the clinic. And we will have a parallel track as well that will try to look at if the formulation should be an oral formulation, so pill or tablet that you take. So we will work on that in parallel as well. So a lot of focus on getting AVX420 closer to the clinic and into patients.
Very interesting to hear more about the development in Avexxin Oncology. Thank you, John.
Thank you so much, Me.
Tack för att ni tittade och tack för att ni följer oss. Vi ses i nästa avsnitt.